Started here. Perfect. Well, welcome. Thank you for joining us for this rendition of the Direct Care Workforce Collaborative. Happy September. Happy almost fall. I can't believe we're 3/4 of the way through the year, but we're so happy you were able to join us here today. We have a super packed agenda, lots of great information. Just really excited to share a lot of these great resources with you all today. So, with that, I'd like to get us going here. So, I did hit the recording button. So, you should have got that little alert. This will be posted to our Direct Care Workforce Collaborative website. And so avoid sharing any protected health information. Just be really cognizant of things that you would like to be posted on a website somewhere for folks to review and enjoy. So just be cognizant of that as we are recording. Use the chat for any questions or comments you might have. We have several team members here that are helping me monitor the chat. You are welcome to ask questions of our speakers through the chat. You can also raise your hand throughout the process as well if things come up. We will be sending out the slides as well as posting them to our website. I'm going to drop those in here for us. There's our Direct Care Workforce Collaborative website. And any questions you might have, you're welcome to email us there at our website or at our email address as well. But the slides will be posted to the website along with the recording. So if you need to review it or you need to share it with other folks who weren't able to join us, it will be there probably 5 to 7 days. We'll get it posted up there for you. If you're listening by phone, welcome. Thank you for joining us. You are able to press *6 to unmute your line and *9 to raise your hand at any point. We have turned on closed captioning, so you're able to either hide that or show that using your black toolbar at the bottom of your screen. And meeting information, again, can be found on our Direct Care Workforce Collaborative website. Past meeting information, upcoming schedules, Zoom information, and also some really great resources can be found there as well. So I would just suggest perhaps bookmarking it and continuing to check it out throughout. So, all right. So today's agenda, just a quick overview. We're going to do a little attendance. Normally I do polls at this time, but I may hold off on the polls until after the leadership team introduction, just to make sure there are enough folks here that we can get a clear picture of who's joining us today. But we're going to do a meet the leadership team. Then we have the Department of Labor Standards and Statistics here to talk about a training opportunity for direct care workers, as well as a workforce stabilization board. Just a little information and overview. Then we have some information on virtual career aligned English as a second language, ESL. Colorado Workforce Development Council is here to share some information about a healthcare summit this fall. Then we're going to talk about ARPA 1.04, which is our resource and job hub, or directcarecareers.com. Then we'll have an update from our standardized core curriculum folks, Colorado Direct Care Training. Judy Scott from UCCS will be here. And then we'll close out with some resources and a quick survey. So with that, we'll go ahead and move into attendance. I'm going to go ahead and do attendance, but we'll come back to polls. So if you want to drop your name, your location, and your role or title, or how you're connected to the direct care workforce in the chat, we can get an idea of who's here. If you're on the phone and you want a roll call, you're welcome to press *6 to unmute your line, and we can make sure that your attendance is captured here. So I'll give folks a few minutes. Perfect. All right. So I'm going to speed past these really quick. I apologize the back and forth, but I'm going to check and see if our co-chairs are here. It looks like Penny and Oliver are here, so I'm going to have them perhaps get us started on our Meet the Leadership Team segment. Penny, would you like to get us started?
Absolutely, I would, Brooke, and good morning to everybody. If you recall from meetings in the past, we talked about the strength of the collaborative, and we identified that the collaborative was really like a strong, think of a strong family rectangular picnic table, and there are 4 very important legs to that table. Well, this morning, Oliver and I are going to lead off on identifying who we are as part of the leadership team, because it's that team that is one of those really strong 4 legs of the collaborative. And we have incredible co-chairs for each of our 3 action groups. And those of you that are active in those groups will probably absolutely confirm the excellence and the commitment of our leaders. I'm Penny Whitney. I live in Colorado Springs, and I've had the honor, actually, of being the co-chair since the very beginning of the development of the collaborative. And I have the unique perspective, I think, of watching the vision, oh, we could do this, we might be able to do this, actually over the last 3 years move into reality. Looking at today's agenda, you see the action that has actually been part of the development of this collaborative. And it is very reinforcing, thinking back to early 2020 when they spoke about the collaborative identified compensation and benefits as being one of the strengths that we really needed to address in order to stabilize our direct care workforce. The other was training and education. And looking at today's agenda, we see multiple representations of the growth and the attention to this area for our direct care workforce. The other milestone, as I reflect on the time in the collaborative as part of the leadership, is the addition of our co-chair, Oliver Giminaro. And so with Oliver, we have moved to the next level. His commitment, his knowledge, his expertise has energized the collaborative to the next level. So it's my pleasure now to introduce Oliver Giminaro. Take it away, Oliver.
Thank you, Penny, and for that great introduction and high praises. I don't know if I'm deserving, but I really appreciate it. As mentioned, my name is Oliver Giminaro. I'm the co-chair of the Direct Care Workforce Collaborative. I've been the co-chair since January, so approaching a year here. I have been living with a spinal cord injury for the last 31 years, and during that time, I've received all types of different direct care, whether it was in a rehab setting, home health care. I've had the opportunity to self-direct my own care for the last 10 years. My mom was a nurse, so I grew up listening to direct care stories. So I'm very passionate about it, and it allows me to lead a full and active life. And so I'm really just excited to work with my direct care workers, and they add a really huge service to our community. And we're dedicated to advancing the public's general awareness of the direct care workforce. As Penny mentioned, we have 3 primary areas that we advocate for: compensation and benefits, training and career advancement, and training, career advancement, compensation and benefits, and awareness.
Value and awareness.
Yeah, value and awareness. I couldn't forget the most important one. I was forgetting. But yeah, so I'm really excited what we're doing, and I look forward to working with you all. And if you have any questions, please reach out. And I'd like to pass it on to Ashley, who is our compensation and benefits co-chair.
Thank you, Oliver. And Ashley just messaged me. Actually, she's having a little bit of mic issues. So Ashley, if you want to give me the thumbs up, I'll go ahead and introduce you if that's okay, unless it's working.
Good.
Oh, I actually can hear you.
Oh, you can hear me.
Yeah. We'll just have you speak up just a little.
All right, let me see if I can hear the mic out here. Oh, is that better?
That's good. Yeah.
Okay, perfect. So my name's Ashley, and I came on this group as just kind of wanting to learn more, and like Oliver, I have a spinal cord injury, and I've been studying rehabilitation, also learning how to become more independent, and in being more independent, I found seats, and with the direct care workers, my arms and my legs, they have lifted me up where I'm in a position now to those who aren't able to be yet where they can be. And so I just saw so much value in her workers that I wanted to be a part. So now I am co-chair with Deborah and in compensation and benefits director of our collaborative, and that's a little bit about me. And I also love helping Penn Judy with the training and their direct care workers and making those training available, and look forward to everybody using them and seeing the tools we can actually come up with and create.
Thank you, Ashley. Deborah, would you like to go?
I'm Deborah Lively. I am the Director of Public Policy and Public Affairs with Leading Age Colorado. We are a statewide trade association. We represent senior living and aging services providers across the state. It includes skilled nursing, assisted living, adult day centers. We have independent living and affordable senior housing. And then we also have the PACE programs in our membership. I got involved with the collaborative a couple of years ago, and it's really because, direct care workers are the backbone of the services that our members provide, and ensuring these workers are paid fairly and recognized for the work they do is a priority of our membership and the seniors that they serve. And I just wanted to mention too, and I'm sure Brooke, you will talk about it at the end, but we do have a meeting on Friday of the Compensation and Benefits Action Group. And we're going to discuss benefits and the benefits cliff. And so we just welcome you all to come on Friday and join us. Thank you.
Thank you, Deborah. Unfortunately, Pascal was not able to join us today. Pascal is our Value and Awareness Co-Chair. She comes from us for Colorado Care Workers United, or SEIU Local 105. She's busy working today, so she wasn't able to join us, but we are so lucky to have Pascal. She's been with us for a good chunk of time now, and has led us through with Hope Carwile, led us through a lot of action regarding our story sharing blog and really getting that Direct Care Worker Appreciation Week off the ground for us. So the leadership team could really follow through on that. So we are so lucky, though, after losing Hope earlier this year, to welcome Brooklyn Reel. Brooklyn, would you like to introduce yourself, please?
Sure, absolutely. Hey everyone, my name is Brooklyn. I am HR generalist for Ariel Clinical Services. Ariel is a nonprofit organization across Colorado, and we are a foster care agency as well as an adult services agency, and we offer those day program services for adults and things like that. So I've been with the collaborative now for, is it been like 3 months, 4 months, something close to like that. So yeah, just kind of getting my feet wet and learning everything. So I have a passion for the direct care workforce and just really bringing awareness to that job that is needed so much. So happy to be here.
Thank you, Brooklyn. And if you're sitting here and you're thinking, oh my gosh, this sounds so cool, and I would love to be a part of it, you have that opportunity, actually. We are currently recruiting for our training and career advancement co-chairs. We actually had a training and career advancement action group meeting on Friday and had a couple folks show some interest. So we are kind of vetting that, making sure it's a good fit for them. But if you are interested in being part of this leadership team, we can find a place for you. We would love to welcome more folks to this. We'd love to have more perspectives and expertise. And so just because we have folks that are interested doesn't mean that you can't reach out and let us know if it's something you'd like to do as well. So we have the star with your name here. We'd love to have a direct care worker. We know that that's a big ask. We know that they're so busy already and they have a lot of stuff going on, but we'd love to have a direct care worker join us. And then just any agency, provider, advocate, anything, we would love to have that. So we're just kind of hoping to put the word out here. And if you are interested, email our web, the HCPUF Direct Care Workforce at state.co.gov. I'll drop that in the chat here in a second, and we'd be happy to talk with you. All right. So with that, since Brooklyn's our newbie, I'm going to make her take us through the purpose and vision just really quickly to level set for us.
Awesome. All right. So our purpose for the Direct Care Workforce Collaborative is dedicated to advancing the public's general awareness of the direct care workforce. So the DCWC DCWC advocates for improving compensation and benefits, training, and career advancement, and publicly recognizing the significant value of the direct care workforce in all healthcare sectors. And then our vision is, meaning the DCWC, envision consumers receiving high quality support and care from a strong workforce of skilled and qualified direct care workers who are well compensated, well trained, well respected, have opportunities for advancement, and have highly sought after jobs that continually attract new entrants to and retain those workers in the direct care workforce.
It's a mouthful, isn't it? That's
Yeah.
basically that's your initiation, Brooklyn, is being able to say that. Perfect. Thank you so much.
You're welcome.
So I think I'm going to go back. We have 55 folks on the call now. I think I'm going to run us back to our polls. And I'm actually not going to run us back through the slides just because I don't want to run back through that. So we're just going to launch some polls now that we're all here. So the first one is going to be, which region do you represent? Where are you joining us from today? Give folks about 20 more seconds here. And again, if you're joining on the phone and you're not able to see the polls, but you'd still like to report, you're welcome to come off mute and we can make sure that that's captured. All right, I'm going to go ahead and end this and share our results. So we are welcoming folks from all of our regions today, which is super exciting. We love having folks from all over. Certainly, we'd like to up some numbers in our regions 4, 5, and 6. So if you know folks in those areas, please welcome them. Share the Zoom link, share the information. We're happy to do one-on-one visits with folks too. If they want to learn more about how it could meet their needs individually, we're happy to do some outreach visits as well. But thank you all for joining us. This is awesome. Let me queue up the next one here. And again, I just want to say, if you're a co-chair and you're not able to answer these poll questions, we know that's an issue. So don't feel like anything's wrong. But the second poll is how you identify on the direct care continuum. What brings you here today? All right, looks like that has leveled out for us. So I'm going to share results. Again, lots of folks from all different walks of life. So thank you to our direct care workers for making time to be here with us today, our individuals receiving services and family members. And then we're always well represented by our employers and providers, advocates, and of course our government agencies. So thank you for being here. We love seeing this. All right, and last but not least, we like to know how you heard about us. So there's a couple options there. If you're looking at that and you're like, that HickPuff newsletter, that sounds fun, but you haven't signed up for it yet, Justin is going to drop a link in the chat on how you can sign up for that newsletter to be connected, not just to workforce initiatives, but all of our Office of Community Living initiatives and stakeholder engagement. Do just a few more seconds here. All right. So the HICPUF newsletter communication, we call that John Barry's newsletter. It comes out twice weekly through Constant Contact. That's a great way to keep a pulse on what's happening in this space. But we also want to thank our employers and our advocacy agencies for sharing the word on this opportunity as well. I should probably share the results so you can see that. All right. Well, with that, I'd like to go ahead and move us on in. Thanks for being patient with me while I got those pulled up. I wanted to make sure we're able to capture a decent amount of folks that are able to join, just because we have folks kind of joining all the time. But before we move into our agenda, I wanted to do a special call out for Happy Direct Support Professional Recognition Week. It's happening this week, the 10th through the 16th, for our DSPs. And we just want to say thank you. We appreciate you. We love the work that you do. Thank you so much for being a part of it. And know that you are always welcome here as well. And we want to thank you, not just today, but every day, but a special call out today as well. So thank you so much for being here. And if you know a DSP, please thank them for what they do this week. Well, every day, but mostly this week. All right, so at this point, I'm going to turn it over to our first presenter. I'm going to stop sharing here and let Carrie take over. Carrie, are you ready to go?
Yeah, I'm ready to go. Hold on just a second. Let me get everything going here. Hi, everybody. My name is Carrie Chesney. I am an outreach manager for the Division of Labor Standards and Statistics, specifically within the Department of Labor and Employment. I'm here to talk to you today about a training opportunity that we have specific for direct care workers, and also, a little bit about what we do, so you guys are aware, and also a little bit of information about the Workforce Stabilization Board. So if you don't know us, and if you don't know what we do, we enforce Colorado wage and hour law. So if you're not sure about what wage and hour law is, specifically, it's basically labor laws that are tailored around wage payment relative to workers, right? So we talk about things like unpaid wages, we handle things like minimum wage violations, overtime violations, unlawful deductions, paid sick leave. And those are just kind of a few of the things that we do, right? We primarily enforce the Colorado Wage Act, but we also have a handful of other laws that we also enforce, such as the Healthy Families and Workplaces Act. And just so you're aware a little bit about our process, we take in claims from workers who have not been paid on some level, or they're expressing that this violation has happened to them. And we do an investigation, and we basically are we engage in an administrative legal process similar to what you would do in small claims court. So we can levy fines and penalties against employers who don't comply with the law. So that is essentially what we do in a nutshell. So we have been partnering with Healthcare Policy and Finance specific to the direct care base wage rate. That obviously has been in effect for a little bit. Our division can enforce the direct care base wage rate partially because we can enforce what is known as agreed upon wages, right? So like if an employer is supposed to, has told an employee like, these are the wages that we are agreeing to pay you. Therefore, that is something that we can enforce. Further, we enforce sort of like the highest level of protections for the employee. So for instance, there is a state minimum wage, right? But there are also municipal minimum wages that are higher than the state minimum wage. We can still enforce those municipal minimum wages. So that's just a little bit about what we do and how we can sort of help with the direct care base wage rate. Just so you're aware, we are also providing trainings now specific for direct care workers. We in the past, traditionally, our division has provided outreach primarily to employers. My cohort, Eric Yohe, who's not here today, he's presenting elsewhere. He typically has done a lot of presentations for employers. That makes sense. The employers are the ones who have to follow the law. That said, we are trying now to get these rights trainings out to direct to workers, so they understand what their rights are with regards to wage law. And so, you know, there's a benefit here for you all, especially if you're an employer, to ask us to come and do this training for you all, because everybody is on the same page. There's a benefit when everybody knows, when the employer knows, when the employee knows. We will always take requests for outreach, whether it's for you as the employer, whether it's for you as the direct care worker, right? We want to get that information out to everybody. Currently, what we are working on is we want to work on doing some in-person trainings, but we also are working on a webinar for our website. We know that direct care workers are very, very busy. So our priority right now is to get a webinar up on our website. We're a little bit beholden to our team that does, you know, our production value kind of stuff. So we're still waiting on them, but hopefully we're going to have that up pretty soon. Also, we want to do in-person trainings. Right now we're looking at different spaces that we can do that in. We're thinking maybe, we don't know yet, but possibly like DVR centers or workforce centers might be a potential place for that. We might be doing those presentations, specifically because they're more neutral, and workers, it's a regional area that, you know, a regional center that people can come to and get education on that. So that is what we are working on right now as far as training goes for those workers. So if you're interested, please do contact me directly. The other thing that we have going is that we have created a direct care specific webpage on our website. We have a couple of educational videos up right now. We're hoping to get a few more up, but again, we're beholden to our other department that does our video production. So we're still waiting to put more of those up. We have what are known as knowledge sheets. So they're basically one-pagers that they're kind of like FAQs, right? They provide a little bit of information about a wide range of topics specific to wage and hour law. Those specifically are directed at workers. We also have info pages. Those are on a different page on our website. Those are a little bit more complicated. They provide more, like, you know, examples, and they provide a little bit more direction from a legal standpoint. So we have all of those available to you. And we also have information about the Direct Care Workforce Stabilization Board on our website there. That is where the current application is for the Direct Care Workforce Stabilization Board. So if you are planning on applying, please do go to our webpage there and apply. And I'll talk about that a little bit here in a minute. The other thing that we have up on our webpage right now is our calendar of events, public presentations. We're going to put our Workforce Stabilization Board meetings up there as well. So hopefully once we start getting those in-person presentations going, we can start putting them up on our website so you know where they are. All right, the Direct Care Workforce Stabilization Board. So this was enacted by legislation effective August 7th. This is just kind of some basic information that's in the legislation. Basically, what this board is supposed to do is to review and provide recommendations for the direct care industry, specific to minimum employment standards, and also specific to how state agencies can improve their communications regarding rights, regarding obligations of employers, and that kind of thing. That's like the most basic definition of what's happening for the Direct Care Workforce Stabilization Board. There are 15 member board representatives. We have 4 from each, the direct care workers or worker organizations, direct care consumers, direct care employers, and then we have a representative from CDLE, HCPUF, and CDPHE, 1 each. So there is a breakdown. There's also a stipulation within the legislation that says at least 1 representative from each of the categories must be from, I believe it's a rural or frontier area. So we are trying to get people from those areas as well. We'd love to have you on the board, guys. So please apply. And just so you know, also according to legislation, the board has to be appointed by October 1st. So the deadline is coming upon us very quickly. It's this Friday, September 15th at 12 p.m. that's just so we can get and review all the applications and make decisions by that October 1st deadline. So yeah, I think that's all I have for you all today. Are there any questions? Yeah, Melly.
Sorry. Hi. I just want to lift up the home care workers that came together, the direct care workers that came together with SEIU Local 105 and Colorado Care Workers Unite that really set this legislation, right? Worked together and lobbied at the Capitol as community members to get this legislation passed, and I'm really proud of the work, and I just want to appreciate the workers that put themselves out there to get this done, and the legislators. It was bipartisan support that helped push this through, as well as the state departments that are stepping up in a really big way to support this workforce. So this is really exciting, and just really thankful we were able to pass this legislation.
Yeah. Cool. Are there any other questions? I'll show you the webpage really quickly. Let's see here. Just a second. Nope. There it is. All right. So this is sort of what our webpage looks like. It's got an overview. It talks a little bit about who's considered a direct care worker. Again, we have our knowledge sheets linked. We're actually going to have more knowledge sheets eventually that are specific to different industries. They're going to be on a different part of the webpage, but we do have one specific for direct care here. And again, we have videos. This is where our webinar is eventually going to go. And here is where you have the Direct Care Workforce Stabilization Board. And then the calendar. So just so you know, it's all there. If you guys have any questions, please contact me. If you're interested in having us come and speak to your group, your worker group, your employer group, please let us know. Please contact me. All right. Thank you. I'm going to stop sharing.
Thank you, Carrie.
Yeah, no
Thank
problem.
you, Carrie. And I dropped the website and also the application in the chat as well. Carrie, are you going to be around for just a few minutes in case a few questions come up?
Yeah, absolutely.
Lovely. Thank you so much. So just connect with Carrie in the chat if anything comes to mind as we're going through this. So, all right. Well, I'm looking at my agenda here, and it looks like we have Candace and Tad here to give us an overview of this virtual career aligned ESL. Candace, are y'all ready?
Yes, we are. I'm just getting my screen ready because knowing me, I usually am presenting and nobody can see my screen. So give me one quick second and I will pull up the right screen because Lord knows I have too many. But good morning, everyone. Thank you so much for allowing Tad and I to join you this morning. I'm just pulling up my screen really quick. Okay, can everyone see the screen? If you can just give me a thumbs up, that'll be awesome. Because I just want to make sure that everyone can actually see the screen. Oh, great. Thank you so much. I appreciate that. Okay, so good morning, everyone. Thank you so much again for having us today. My name is Candace Hextall, and I am the VC ESL manager for the Office of New Americans. And joining me today is Todd Wamister, our director of partnership development for one of our vendors called InGen. And today we're going to briefly talk about how the VC ESL program, how it works, what it is, how ONA has aligned our work with InGen, and how InGen can best serve your needs as you begin to think strategically about recruiting English learners into the healthcare field. But before we begin, I know that I don't have much time on this agenda today, and I know that you'll have more questions for us throughout today's session. So we wanted to make sure that everyone's question gets answered, even if we run out of time, which is why we created the Q&A session Google Doc that you see here on your screen. And I just want to make sure that we're able to capture all of your great questions. So I will drop the link to the document here in the chat, make sure that everyone can see that. Okay. All right, so this document is available to everyone here on the call. You all have editing rights, so you will be able to drop and capture all of your great questions here in this document. So please make sure that you put your name and email address and your question in the correct column. So here on the screen, you can see that there are two different columns. One is for the Office of New Americans and one is for InGen. So if you have a question for InGen, put it in the engine column. If you have a question for the Office of New Americans, just go ahead and put it in there, and we will make sure to respond to your questions. So we will make sure to reach out to any individuals whose questions didn't get answered, but you will have access to this particular document for 1 week, and then it'll be taken down. Okay, so really quickly, I would like to briefly introduce myself. Again, my name is Candace Hextall. I'm the VCESO Program Manager for the Office of New Americans. My entire background is deeply embedded in education and advocacy for English language learners. I have taught English language learners for the better part of 12 years, probably longer than that. The grays kind of get hidden underneath his hair, so don't even worry about that. But I have been assisting New Americans for the better part of 20. I assisted with resettlement efforts here in the state of Colorado. And as I taught, I also taught in North Carolina, which is my home state. And I've also taught here in Colorado. But as I assisted with the resettlement efforts here, I directly supported newcomers, students, and their families as they transitioned to this district. I worked for Denver Public School District. But now I am just thrilled to transition to helping our adult language learners, as I am a staunch advocate for providing greater access and opportunities to our New Americans, as well as removing those barriers and obstacles to their success. Being a Black woman raised in the South, I faced a lot of obstacles, and so I just don't want anyone else to have to go through what I went through in the South. But now I am going to introduce our special guest, so I will turn it over to Tad.
Hello. So my name is Tad Wamister. I'm Director of Partnership Development at Engine. I've been a part of this team for about 4.5 years, and I get to work with all different types of organizations, from unions to community colleges, library systems, as well as employers who are trying to upskill their workers and include New Americans in their workforce, providing them also with career opportunity. Prior to coming to Engine, I spent about a decade at a national nonprofit called Upwardly Global. That organization works with immigrants and refugees who have degrees from their home country. So we could be talking about doctors, lawyers, nurses, engineers, who unfortunately fall into low-skilled roles, low-wage roles, or unemployment because their credentials don't translate. They need to learn English, they need to get relicensed. So I have a lot of experience with that population, as well as refugees.
Awesome. All right, so what is the VCESO program exactly? I have to backtrack just a little bit. So the passing of Senate Bill 22-140 in June of last year tasked the Office of New Americans to establish this virtual career-aligned ESL program to help ensure that our English learners here in the state of Colorado have access to high-quality work-based learning, job training, and employment opportunities. But I always highlight high quality, because we've seen lots of different job training programs and they don't quite measure up to what they need to be. But this legislation ensured that we would have and create access to high quality work-based learning and job training. So the VCESO program will also support and assist employers and other workforce stakeholders to recruit, serve, hire, and promote English learners here in the state. But in a nutshell, this program provides career and sector-specific online adult English language courses via English learning digital platforms, which helps our New Americans to build the skills they will need in order to navigate and access our state's growing workforce. So let's just say, for example, there is someone who is maybe working in the janitorial position and they already have a medical background and they want to get back into the medical field. Well, our vendors have career-specific courses that would help build upon their skills and give them that career-specific technical terminology and experiences and workforce-related scenarios that they would actually need in order to access that field. Because we already know that there are so many individuals out there who already have the background and the skills that they need in order to be successful. English is just the barrier. And so that is where the VCESO program comes in. So we have various purposes and goals. And so we have 3 right here. So we want to make sure that we are effectively providing New Americans with the tools that they'll need to plug into and access sector-specific industries. And we also want to help our new Americans, especially in those areas where ESL classes and courses may not be as easily accessible, by giving them greater access to digital platforms that will help them to truly enter the workforce. I am from a very, very small town in the middle of nowhere in North Carolina, so I understand not actually being able to have access to those resources. So that's very important to me. But the last purpose and goal that we have is that we want to upskill, reskill, and expand the talent pool of employees in these high demand sectors. So we're currently working with 2 vendors that are providing their English language platforms to the VCESO program. They are absolutely positively impacting the lives of our immigrant and refugee population. But the one vendor that I want to highlight today is Engine. Now, Engine is an online and mobile industry-focused English language learning platform with scalable and accessible adult ESL instruction to help accelerate career pathways for English learner job seekers, students, and incumbent workers. They are a certified B Corporation, and they deliver personalized, contextualized, mobile-first English language upskilling with immigrants, refugees, and speakers of other languages specifically in mind. They have served over 4 million English learners since 2012, and they're currently working with the Office of New Americans to create new career-aligned pathway courses that use real-world content. And this particular program, the VCESL program, it's one of the first of its kind in the entire nation, and we are very excited to be working with everyone. So I'm going to pass this on to Tad to talk about Engine's platform.
All right, thank you, Candace. Well, I want to talk about why this is so important. We are working with many employers who are hiring refugees or making refugee hiring commitments. But it's very important to build around that the wraparound services to make sure that those individuals have the supports they need to succeed. As Candace mentioned, English is the #1 barrier to integration and access to opportunity. Employers can play a really important role. What we have found working with some of our employer partners, ranging from Chobani, Tyson Foods, as well as hospital systems, is that when you offer English as a benefit, it is a multiplier effect on your retention for those workers. And they also have a tendency to refer other individuals from their community, so it can help with attracting new talent. Next slide. But we do have some challenges in this country. Nationally, the Migration Policy Institute estimates that we're only reaching about 4% of adult English language learners through existing programs. And there are many reasons for this. We do have many programs that are relying on outdated or ineffective curriculum that is not focused on careers, career pathways. It can be focused on either academics or conversation. Also, new Americans can experience significant barriers to participation, ranging from childcare, transportation, fixed schedules, and even irregular schedules, because they can't predict when they'll have the time to join a class. There is a shortage of providers and a shortage of funding. So as I mentioned, only 4% of adult English language learners are receiving instruction. So we believe that workplace-based and career-focused English language learning delivered in a digital format is a huge part of the solution. Next slide. So I want to go into a little bit more detail about what Engine is. And our mission is to break down barriers to English language learning. We want to move the needle on that 4% number. We are not a direct-to-consumer product, so we're always working with partners, whether they be an employer, whether they be a community college, and we are working to improve access to opportunity. How we deliver upon our mission is through a web and mobile tool. So Engine is accessible on any device that someone has internet access, ranging from smartphones, because we do have iPhone and Android apps, tablets, Chromebooks, whatever they're using to access the internet, they can access Engine. And they will get a highly personalized experience. It is personalized based on their native language, their career goals, their interest areas, and their performance. Engine adapts in real time. And we have a growing career pathway catalog. We recently added English for sterile processing, English for behavioral health, and we have a full suite of allied healthcare courses that through this partnership we're expanding. We're adding English for MRI tech. And any organization that is using this tool, they can see what their learners are doing in terms of time on task, lessons, units, and courses completed. Next slide. And this program is incredibly unique. We created this slide when we were trying to educate employers on refugee hiring initiatives and how important it is to give those individuals opportunities for upskilling, for advancement, to provide the coaching and support, which is a core component of this program. These learners don't just get access to a digital tool and are told good luck. They have a coach. They have live online support, phone support to help those learners make sure that they're accessing the right content, that they are motivated. And as a result, by accessing these integrated education and training, they can work towards credentials that will improve their wages and provide them with long-term career pathway opportunities in the healthcare industry. You can go to the next slide. Workplaces are actually ideal environments for learning English, especially when that content is tied to the needs of the workplace, whether that be safety, whether that be patient care. Individuals will have the opportunity to practice that English that they're learning in real time. Again, the employer, as well as the VCESL program, will have data on that individual. And so they can rapidly develop the English they need to serve patients, to succeed in other training programs, and to grow their career in healthcare. Next slide. We're very proud of our impact. It's what we are focused on. And we have a 2023 impact report that I will put in the chat after we complete this presentation, because it will share data on how these learners are achieving career goals. They're achieving their personal goals. How we do this is through this growing career pathway catalog. We have over 130 courses in that pathway related to career fields, as well as other important topics like personal financial literacy or interview skills. They're also, and this is something that is unique to Engine, no other platform offers this, small group live instruction that is available 24/7 by proficiency level. So this is really changing the way that people can learn English. They can get that practice, interaction, conversation online, as well as these deep, self-paced career pathway courses. Next slide. So how do we do this? Well, and this is very unique. Engine takes real pieces of content, training videos, news articles, and we don't translate everything. We transform these videos into language lessons. Our platform is adaptive, and actually it creates 218 personalized activity sequences. So in this case, if you can see on the screen, this is an example from our English for food safety. We took a video on food safety or on avoiding cross-contamination. Learners will get keyword translations for the important keywords and context, but they'll be answering questions in English. Are they understanding this content? Are they building up that industry-specific vocabulary? Next slide. So this is just digging into that lesson a little bit further. You see on the right-hand side of the screen these vocabulary words that are very important to understanding the topic of cross-contamination in food handling. So if learners were to click on those keywords, they're going to get a translation for that keyword into their native language, and this works with 72 different native languages. They'll also see the context translated into their native language. They'll have a video, there'll be closed captioning in English, and they will go through a series of 3 different activities based on real life scenarios, industry-specific English that they'll need to succeed in that workplace or in that training program. And so we helped them to really set themselves up for success, both in the workplace and in training programs. Next slide. And we have tens of thousands of lessons in the platform. One of the things about adult learners is that they learn what they need to learn and what they want to learn. So the more that we can make this aligned with their career goals and the job that they're doing, the more engaged they will be, and the more rapidly they will develop those proficiency gains and communication skills. Next slide. I mentioned that we are, delivering impact for the learners, but there's also a huge ROI for the employers that are participating. This is some data from our impact report that learners are achieving career goals, promotions, access to training. They're also 89% more likely to stay at their current employer. So this is driving retention. And also we are helping them to achieve proficiency gains. You can see the answer to these learners when they were asked, has Engine helped you in your current goal, in your current job role? So it's helping with communication skills, confidence, engaging with patients and customers. So we're really proud of the impact for both employers and learners. Next slide. I did want to highlight some of the healthcare career pathways that we have available. So you'll see that these are some of the top allied healthcare career fields in Colorado and nationally. We just added sterile processing. We have a course for emergency medical technicians, for nursing, for NCLEX, the nursing test, nursing assistant, patient care. So all of these courses are available to those learners. Again, it's helping them to improve confidence, proficiency gains, career goals. And we have been working for several years with Maine Health, the largest employer in the state of Maine. And as Candace mentioned, they are using this with food service workers, environmental services workers, who are they're already employees, they're already showing up to work, but they can fill harder to fill roles if they're able to improve their English and gain access to the workforce development programs that exist in that hospital system. Next slide. And this is just one course. So I mentioned that we have these lessons. These are micro learning experiences. They take 5 to 8 minutes. But this course, Introduction to English for Certified Nursing Assistants, this is designed to help beginners learn the industry-specific vocabulary, keywords, and phrases so that they can succeed in working as a CNA and also, in the licensing exam. These micro learning modules, there are 100 of these in these course, 10 end-of-unit assessments. So, just as an example, at Emily Griffith Technical College, they use this to understand if their English language learners are ready to transition into that technical training program that they offer. Next slide.
I think it's back to me, so you're good to go.
Good. All right. Well, thank you so much. And again, I'm going to put some information on that impact report in the chat. And if you have any questions about Engine, don't hesitate to reach out.
Awesome. Thank you so much, Tad. So we are pleased to partner with so many great organizations and businesses. So as the VCESL program continues to enroll new learners literally every single day, we are excited to partner with these employers and businesses, institutions of higher education, public library systems, the career centers and workforce development partners, in addition to our immensely vital immigrant serving and facing community-based organizations and other nonprofit organizations. And we know that by working together, we can help our new Americans to get the services they need in order to successfully enter and stay in Colorado's workforce. So I'm going to go very, very quickly because I just have a few more slides left. And I wanted to make sure that I hit all the important parts because this is where I usually get the most questions. So underneath the eligibility criteria, remember I said I am a staunch advocate in removing barriers to individual success. And there you have it. There are 3 eligibility criteria, okay? So individuals have to be 18 years of age or older. They need to be a resident of Colorado, meaning that they could have moved here just yesterday. Congratulations, they're a resident. And they have to be an English language learner. We do not require any documentation or paperwork to prove any of this. If someone's first language is not English and they are learning English, they're an English language learner. It's pretty straightforward. But we understand that, for many other programs, there may be unnecessary barriers to access. And we just wanted to remove as many barriers as possible to make this program as accessible for new Americans. And underneath the frequently asked questions, these are the most frequently asked questions that I receive pretty much on a daily basis about the program. And the first important piece of information to note is that this entire program is of no cost to learners, any partners of ONA or the VCESO program. It is 100% free. The second piece of information that I want to share with you is that this program is not just relegated to the Denver metro area. We are not the Denver Office of New Americans. We are the Colorado Office of New Americans. And so we make sure that this program is offered statewide so that any eligible individual who would benefit from the program has an equal chance to do so contingent upon sufficient funding. And then the third piece, Tad already touched on this very briefly, but all of the courses that are provided by our vendors are 100% accessible on any working mobile device, which includes cell phones, tablets, laptops. And this really is important to me because as an educator, I wish I had had a program like this to help my students. But this part of the program increases the portability and the flexibility and the ease with which learners can actually take these classes. And so this gives them greater agency and autonomy over their own learning. Just like Tad was saying, some individuals might have a very fixed and rigid schedule, or they might have a very infrequent or unstable work schedule. And so they need to be able to attend these classes on their own time. And thankfully, these are online, so they don't have to go anywhere. So that removes the need for them to have to, figure out and arrange childcare or transportation or other barriers that are typically there with other courses that are held at places like libraries or other facilities in a time where they're actually at work. So I'm really excited about that part. So if you're interested in learning more about this program, or if you would like to partner, you can use your mobile device now to scan the QR code that you see here on your screen, or you can just wait for me to drop the link in the chat. And this will take you to the Google document that we have up here. And this is a super quick Google document. It will take you to a Google interest form, and it takes literally less than 3 minutes to complete. It just gives us your contact information so we can reach back out to you if you're interested in partnering with us. And I know that I am almost at time, and thank goodness I am on the next to last slide. Okay, but if you would like to contact me, please reach out to me at Candace, CANDACE.Hextall, HECKSTALL at state.co.us. And my hours are Mondays through Fridays from 7:30 until 4 p.m. So thank you so much for allowing us to be here today. And do remember to drop any questions that you have for us, because I know we don't have time to answer questions today. Please drop those questions in the document and we will respond to you. And that document will be available to you in 1 week's time. So for 1 week's time. So thank you so much for allowing us to be here today. We are excited for a partnership and to just continue positively impacting the lives of our new Americans here in the state of Colorado. And we know that with your help, we will only strengthen Colorado's incredible pool of talented workers. So thank you again, and I will stop sharing, and I hope you guys will have a great day.
Thank you, Candace. Thank you, Ted. We did actually have, and we have just a minute, a question come into the chat. Jen Oaks is wondering if Engine is only available through employers.
Through employers? Not necessarily. It could be available through a particular entity. Normally it is through an employer, but it doesn't necessarily have to be. So if there is an individual who wants to enroll individually and not through their place of business or through their work, they can actually do that, no problem. All they have to do is just reach out to me.
Okay, we have a couple folks here, and so I'm going to ask for them, I guess, technically, that do participant directed. And so they're actually kind of the employer of their own direct care workers. And so that's probably where some questions might come in of being able to access these services if they're technically the employer. So,
Yeah, they can
okay,
absolutely. All they have to do is reach out to me if they are an
lovely.
employer and they have a certain, amount of workers that they would like to get licenses for, because we really dispense with licenses.
Lovely.
They can reach out to me, no problem. They can complete that interest form, and that will actually say or ask you, it'll prompt you to say how many licenses we would like to have. So
Okay.
it's like a range of seats. Yep.
Lovely. Thank you so much, Candace. Thank you, Tad. We
Of
appreciate
course.
it so much. And I went ahead and dropped that question doc back in there. So it's at the bottom of the chat. So feel free to keep using that. We love it. So at
Awesome.
this time, I'm going to pass it over to Bobby to take us into our next topic.
Good morning, everyone. Hello, I'm Bobby Wolf, the Senior Consultant for Sector Partnerships and Industry with the Colorado Workforce Development Council. Thank you to Brooke and the leadership team for allowing me to be part of this agenda today. I'm learning so much and just honored to be part of the rich information sharing. For those that are not aware of the Workforce Development Council, or CWC, to avoid a mouthful, it is a governor-appointed public-private partnership with the purpose to advise, oversee, and integrate the work of the Colorado Talent Development Network. Our vision is really around every Colorado employer having access to a skilled workforce and every Coloradoan having the opportunity for meaningful employment, resulting in individual and statewide economic prosperity. And our mission around this is really enhancing and sustaining a skills-based talent development network that meets the needs of employers, workers, job seekers, and learners for today and tomorrow. Our values of equity, agility, and integration are key foundational elements of how we're able to live this out. And thinking through integration, one of the ways that we do this here at the Workforce Development Council and really throughout the state is uplifting a nationally recognized model called Next Gen Sector Partnerships. Sector partnerships are regional public-private partnerships targeting key industries in Colorado, and they are led by industry. If you can see the graphic on the right side, industry is physically in the center of discussions. They're the ones that are setting the agenda and really driving what they want to identify as solutions for their shared barriers. Sector partnerships are an opportunity for industry to come together to be collaborative, as they recognize that it's important for them to be able to come together for these issues because it's easier to tackle something together versus by themselves, especially for small businesses. Throughout our state, we previously had over 30 sector partnerships. With COVID, a lot of them went away, especially healthcare and especially in rural parts of the state. Now we're back up to around 23, and we have 3 active healthcare sector partnerships throughout the state. Northern Colorado Healthcare Sector Partnership just celebrated 10 years this past August. There's a Southern Colorado Healthcare Sector Partnership that launched earlier this year that encompasses Colorado Springs area, Pueblo, and they tap into Fremont County with their existing behavioral health focused sector partnership. I was excited to see participants here on this call from Alamosa and Boulder. Alamosa is in the works right now. They have industry partners coming together and they're eager to launch their own sector partnership to create solutions for their community. And Boulder will be launching a sector partnership this month. So if there's any interest around trying to connect in with these different regional groups or connect in with the statewide conversation of sector partnerships, I'll put my contact information in the chat in just a minute. I'm here today not just to talk about sector partnerships and spread awareness around that, but to share about an upcoming workforce summit around healthcare, our healthcare workforce summit. This is happening this October 26th from 9 a.m. to 3:30. Let me drop in the chat as well the save the date information. Let me see. There you go. It's going to be a hybrid format, but we will be having it in person in Pueblo with about 200 attendees being able to be present in person. We'll have more availability online, capping out around 500. But I'm here today really wanting to spread the word to ensure that this event has the opportunity to have direct care workforce voice heard, and especially employer voices. As thinking through just the in-person day, this is going to be a day filled with hearing directly from industry what their barriers are around navigating policy, funding, programmatic issues that they face, and also what they're excited about around solutions. We'll also hear from a number of different industry partners about what they're doing creatively with their different public partners in their regions to work around apprenticeships or micro-credentialing, doing new strategies to attract and retain their talent in their communities. And by being in person, you're able to have your voice really be heard for statewide and regional solution building. We'll be doing mapping exercises and really digging into what do we want to test out in our regions? What do we want to be working together as a state as we think through how do we help the healthcare workforce shortages that we're facing all over? I mentioned our sector partnerships because the ask around the Healthcare Workforce Summit came directly from industry. They wanted to have one summit directly focused on workforce shortages. I'm sure many of us have seen there are many summits going on, and conversations on healthcare it can feel nonstop at this moment. So to have this dedicated day focused on workforce and really infusing the work that's been happening in these different pockets, I'm really excited about it and just building off the work that's been going on in the state already and trying to bring a little bit more clarity and connection across all our different agencies and employers in the state. So I'm here asking for help spreading the word. I've dropped in the save the date information. Excited to share that our registration will be official on Friday. So if you follow the save the date information, you should be able to follow along and sign up for more information and be able to be sent that registration link directly this Friday. I'm also here because as wanting to ensure that this event is centered in industry voice, very similar to sector partnerships, I am reaching out for recommendations around direct care employers to be focused and featured on a panel for them to be able to share out the barriers that they're facing. Talked about this with a leadership team last week, and I want to ensure that the direct care employer, it could be, I know there's different facets of what that might mean. Is it nursing home? Is it nursing? What is the focus? Really, I want it to be what this group desires to have as the key voice. And also, I encourage to have more employers involved throughout the day as well. The panel is one opportunity to have a voice shared, but by being in the room and being present, there's other avenues to have the direct care workforce voice shared as well. That was just a brief little snippet. I'm happy to take any questions that people might have. I'll drop my contact information in the chat as well. As questions come up or as the registration comes out, I'm happy to connect.
Thank you, Bobby. And I just want to make note too. So Bobby came and presented with the leadership team last week, and we had kind of thought, looking at all of the direct care employers that we have, long-term care, we have home and community-based services, we have participant direction and stuff. So really across the gamut of really identifying what's going to be a good fit for this, but encouraging all, across the continuum to participate as well. Even if you're not sitting on the panel, you can still, network and ask questions and make sure that voice is heard. So Emily is asking, where on the page do we click to have the link sent on Friday?
Thank you. I thought that there was a link directly on this blog post to sign up for our newsletters. It looks like I'm not seeing that. Emily, I'm seeing your email or your ask for the registration. So I will make sure that you end up having that just on my end. I'll do that on the back end. If there's anybody else that's also interested in making sure the registration gets sent directly to you, feel free to message me privately here in the chat or email me directly.
Perfect. Thank you, Bobby. And as you kind of think of this and chew on this and you think, I think I might want to be involved in this, or, as a panelist, or if you have questions and want to connect with Bobby one-on-one, you're also welcome to reach out to our direct care workforce email too, and we can get you connected with her just to make sure your questions are answered and we get your voice at the table. So thank you so much, Bobby. We appreciate it. All right. I am going to pull us back up here. And get us going again into our next topic, which is actually our resource and job hub, or our directcarecareers.com, ARPA 1.04. So we have John Hendricks here from our team, and I will pass it over to you, John.
Thanks, Brooke. Hello, everyone. My name is John Hendricks. I am the Direct Care Workforce Support Specialist, and I'm here today to run down the ARPA 1.04 project and where it is today. So according to Financial, hiring and replacing a direct care worker can cost upwards of $2,200. ARPA 1.04 was established to create a resource and job hub for direct care workers and agencies and self-directed employees. The initiative not only facilitates placement of direct care workers, but also streamlines the process of hiring, saving both time and money. The Resource and Job Hub, or directcarecareers.com, is a specialized platform offering information about direct care positions and houses a job search function, employee matching, resources, free training coming in 2024, and job board functions that can quickly match interested individuals to open positions. Next slide, please. We are launching a limited beta rollout, and we are seeking partnerships with direct care workers and direct care agencies working in HCBS waiver services to participate in the final stages of the site's development. This phase requires the participation of both direct care workers and provider agencies who are willing to volunteer for the initial rollout of the site. So we're going to have this kind of beta phase, and we need those collaborators, and the success of the initiative is really going to depend on active engagement. And we are inviting you to lend your expertise and insights during the beta phase by assisting us in fine-tuning the platform's features so that they align with the needs of both direct care workers and HCBS waiver providers and health direct care worker agencies. Next slide, please. All right, so our objectives for the next few months is to collaborate with a minimum of 20 direct care provider agencies to help refine the site. So we are seeking agencies that are not only willing to use the site and help us test its functionality, but also to invite them to display directcarecareers.com on their signature of their emails on their website, and to promote awareness of the website through word of mouth efforts. And if you're interested in participating in this rollout, we really encourage you to indicate your interest by completing an online application form, which is linked here. I'll throw it into the chat, and is also on John Barry's Constant Contacts newsletter that Brooke had mentioned earlier. So that's kind of a really quick rundown of what's been going on and what we're looking for in participation with the beta rollout. Are there any questions from any of you?
Just a reminder, you're welcome to drop them into chat. We'll give folks a few minutes there, but you're also welcome to raise your hand, come off mute, ask any questions about this.
And if you don't have any right now, or one comes to you later, you can also just ask your questions and hit us up at the HECPUF Direct Care Workforce email as well.
Perfect. Thank you so much. And I know that John will be here probably through the end of the meeting at least. So if questions come up, you're welcome to just private message him, or we can get you connected through that email address as well. But certainly something exciting and something we'll continue to kind of keep a pulse on, and hope that folks get involved and find some use in it. So thank you, John.
Thank you.
All right. So next up, a little bit ahead of schedule, we have our Colorado Direct Care training update from Dr. Judy Scott. Judy, are you with us?
here I am.
Lovely. Thank you so much. I'll kick it over to you.
There we go. Well, hi, everybody. I want to thank you for your time this morning. This is a lot of exciting information, everything from the discussion about our ESL and our DLSS training. So, and all of these really intersect well with what we're about to talk about with the curriculum topic, and even the job hub that we were just talking about with John. So I'm going to give you an overview of the curriculum timeline, a brief summary of our course development and pilots, and we'll stay a little time on this slide, Brooke, and the processes. And I have a couple asks to this group that we're looking for more pilot opportunities for the curriculum we've developed. But it's hard to believe that a year ago, you know, we had just about an outline that you all had put together through training and advancement and through priorities of the 25 modules that you wanted to see the lessons for the curriculum. So this timeline, it gives us a snapshot of what's be coming up early in spring of 2024. And as John said, in this Direct Careers Hub is where this curriculum is going to live in spring of 2024. Right now, the modules that you are seeing are in the RISE, Articulate RISE platform, and that integrates really well with the State Job Hub, the Direct Care Careers Hub. So right now we're in the process of building the specialized modules that I'll tell you a little bit more about. We finished the first 16 educational modules, so it gives you an idea of, you know, where we are working. The comprehensive core curriculum of the 16 modules includes the fundamentals for direct care work, member rights, ethics and professionalism, member health and safety, personal care, nutrition, and hydration. And so these modules, they combine foundational knowledge, practical skills, soft skills, communication skills to grow and support direct care workers in their employment. Within each module, there are lessons themselves and knowledge checks, videos, reflection prompts, and the assessments at each lesson. We're in the process of adding key terms to each module that was told to us to be important, and prompts that would indicate that a particular lesson is going to be important to someone with the homemaker role only. We are adding videos as we go, with several new videos nearing completion, and we're planning the specialized modules, as I mentioned earlier. And what's in there will be care of older members, care of children with special needs, care of members with intellectual and physical disabilities, and end of life. It's important that all of these modules are getting great review, and they are. The HICPUF team reviews each module, and then the curriculum team has accumulated all that feedback and keeps a spreadsheet of it and combines the feedback with what we're getting from our pilots. That is the direct care workers and trainers who are actually testing out the modules. And then from our advisory group, who, when they meet quarterly, they dig into selected modules and provide their feedback on a whiteboard, a virtual whiteboard, the Jamboard. So we have our quarterly advisory meeting tomorrow, where we will dig into modules 9 through 16 and talk about the pilots that we've conducted and the need to conduct more pilots to maximize our geographic diversity, our waivers, and our employer types. And finally, the curriculum will be translated into Spanish as we have reviewed and revised the modules. So it's great to hear about the ESL link here today. Okay, now we can go to the next slide. Okay, this is great. So the project evaluation overview, I'm going to skip over here. Really great thanks to Dr. Joey Lee at UCCS, our terrific student worker, Jillian Rager, to Penny Whitney, for making sure that we're collecting the feedback from our direct care workers and from our trainers. So after a module is piloted, the direct care workers complete a brief assessment, including model satisfaction, effective learning strategies, the skills, or how they feel they're becoming more competent in them, and then open-ended feedback. In addition, we've done some listening groups or focus groups with our training leaders and with the direct care workers. You can go ahead, Brooke, with the next slide. Okay, fantastic. So there is a Qualtrics survey that follows each of the modules, and the direct care workers are surveyed about their satisfaction with the modules. And you can see here that the satisfaction is high, with most of the direct care workers agreeing that the modules are organized, help them learn, is relevant to their job requirements, and then their level of comfort learning the new competencies or skills. And you can see that's probably those two outcomes are a little lower than the others because these are usually new DCWs who are just getting to learn the job role at this point. Okay, next slide. Here you can see that just the project evaluation overview from the direct care workers' point of view. Are the modules excellent, good, average? Well, all of them were either excellent or good, and there was nothing in the poor category. So we're satisfied that we're going the right direction. From our anecdotal and focus group data, we are hearing good satisfaction. We're getting great suggestions for edits, which we're accumulating with all the other feedback that we get to make a better course for them. Next slide. And finally, this slide explains how the direct care workers consider the lessons from their work-related competencies following their training. So you can see from these bars that between 78 and 90% of direct care workers are confident in understanding their role, providing person-centered care, and supporting independent living. This is really good feedback for us. Trainers are also giving us their feedback. For example, their consensus confirmed that they like in-person training, allowing the trainer to offer more information on a topic, or let's call it context. A good example that I'm thinking of right now would be the module on nutrition, for example, where the ideal nutrition for, the recipient of care, the member, is going to be talked about here, but the real situation might just not be exactly the same. So the trainer might be able to talk about, resources for healthier food choices at an affordable price. And these resources are included in the module, but this is a great place where context really matters because there are many diets and many diet needs. So that was a good example. Overall, trainers are very happy with the curriculum. Some discuss moving from outsourcing their current training to using the CDCT, whether it be all or some, or pick and choose the modules. In addition, many of the modules can be done as self-study, so the direct care worker can complete those modules on their phone, tablet, complete the pilots this way also, which makes it for the best flexible program. And I think that's all. One more. Great. Finally, I do have an ask of this collaborative. Later this morning, we're reviewing our pilot interest data together and continuing to reach out for opportunities for our DCWs and trainers to try out their modules of choice. So if you are interested or you think of someone who might be able to help us out, please do reach out to me or Penny Whitney if you have that interest or time. We're also looking for subject matter experts on topics like end of life or children with disabilities, And we are putting together Zoom listening sessions all the time to inform the curriculum. Right now, though, we have gotten to our goal of 8, and we'll get to at least 10 pilots to accumulate that data. And then once those core modules are completely reviewed, then we can give some of them to John and his team to put into the Direct Care Learning Hub for piloting and beta testing there, so that as time goes on, this will all work fairly seamlessly, we sure hope. So for all of us on the CTT team, thanks for your time and interest as we reach the goal of providing Colorado with this curriculum to maximize and professionalize the work that our DCWs do every day, which we are greatly appreciative of. And I think I talked kind of fast, so we might have time for questions. If anyone has any, please fire away.
I'm not seeing anything come through yet, Judy.
That's because it's lunchtime, so
you're between them and lunch, huh? Dang.
So go ahead and put them into the chat if you have any. I know this was a high-level overview, and I really appreciate the time.
Yes, thank you so much, Judy. And if you do have an interest in this specifically and would like to dig in a little more, we usually have updates from this team in our training and career advancement action groups every couple months. So you could really dig in a little bit more there if you'd like. So, all right, well, I'll go ahead and move us into our closing then. Thank you, Judy.
You're welcome.
All right. So I'm just going to drop some resources into the chat. While I'm doing this, I would, since we have a few minutes, I'd love for maybe Heather on our team to talk a little bit about these grants and this website that I'm dropping in here.
Thank you. I will close you all out with, I'm sure you're not tired of hearing me hype up our grants, but we do have 5 more cycles for the provider grant. The next one closes September 30th, so you do have time to put in an application. If you check out the grant website, you can see the numerous grants we've already awarded and get some ideas of maybe what folks have gotten going, and that might inform you on what you want to apply for. Also want to share that we do have the Direct Care Worker Grant, $500 reimbursement based for any higher level training. So please share that with the direct care workers that you know. They do need to work within HCBS or have a desire to work within HCBS. So those grants come out. I mean, we issue them as quickly as we can, and so they're not on any cycle. We have about a 15-day turnaround time on awarding those. So share the information about grants. They will run through August 30th, 2024. Thank you.
Thank you, Heather. I'm going to drop a whole bunch more in there. I just wanted to call out the grants specifically, and I'm going to drop these all at once. Melissa's asking, while I drop these, will workers get paid more when they complete modules? I'm assuming you are talking about the standardized core curriculum, Melissa. Is that correct? Yes.
I think that would be dependent. Sorry, this is Heather. I think that'd be dependent on whatever their agency is planning. These are entry-level trainings to train somebody to be a direct care worker. And so it would really depend on how that agency looks at how they're doing the training. I would say by and large, since they are that entryway into working and replacing whatever training that already is there, there's not really a step increase to do the entry level training. But again, each employer could decide to do that differently.
Perfect. Thank you, Heather. And then also, is there a certificate that is printed after completion or just some kind of notification?
Once with the pilots, I'll have to defer to Judy on that. Once we are rolling them out through HCPF on our direct care career site, there is a portable certificate with that. So it'll be available on the site for applicants. And the idea about having that portable training is that folks don't have to take the same training if they move from Pueblo to Denver and work for another provider. That training is already, the competencies have already been determined. So while they surely will have to do some training, they wouldn't have to do the whole bulk of all the direct care training. So that's really one way we want folks, even if you have a robust training department, we would love for you to vet this these pilots because, or, participate in the pilot, because then you would know if you're going to accept that certification for somebody who's a new hire to you, and that saves you that time and resources on training those for training they've already received.
And I think you just about hit every point I would have said, Heather. We have designed the modules to have badging at certain points through the curriculum, and one badge for every specialized, meaning that, a direct care worker may not need an end of life module badge right now, but may later, and could bank those for a time when they do need that.
Perfect. Thank you both. All right. Last but not least, I want to do a quick reminder of our next collaborative meeting, which will be Wednesday, December 13th at 10 a.m. There's information on the website there. You can email us with questions. And my last ask of you, I dropped a link in the chat for a survey. We'd love to hear your feedback on these meetings. We'd like to hear what's working, what's not working. So if you could take 60 seconds to complete that, I would appreciate it so much. And we look forward to seeing you next time. Thank you so much for your time. We appreciate it.